Hello, I'm Marian Mulkey, Director of the California Healthcare Foundation's Health Reform and Public Programs Initiative. Our foundation works as a catalyst to fulfill the promise of better healthcare for all Californians by supporting ideas and innovations that improve quality, increase efficiency, and lower the costs of care. Big changes are coming in the way Americans get and pay for their healthcare. By 2014, the National Health Reform Law, known as the Patient Protection and Affordable Care Act, could help as many as 32 million Americans who now have no health care to receive coverage, and it will transform the way many others are covered. One way this will happen is through some major reforms to the health insurance market. A number of protections were put in place by health reform in 2010 and 2011 to increase access to health coverage for those who need it. For example, insurers are no longer allowed to limit lifetime coverage to a set amount. They also may no longer revoke someone's coverage because of a mistake on an insurance application. And young adults can now remain as dependents on their parents' health coverage up to age 26 if they aren't yet covered through a job. Insurers also can no longer deny coverage to a child because of a pre-existing condition. Since the law passed, nationally, thousands of uninsured people who have prior health issues have enrolled in a temporary program that provides coverage until 2014. So far, a relatively small number have enrolled in the program due to the eligibility requirements and fairly high premiums. But those enrolled benefit from better access and security. Premiums are slated to come down in fall 2011, which should expand enrollment. Although many details are yet to be worked out as each state grapples with how to implement the law, the way in which people will access coverage will be changing too. In 2014, individuals will have insurance choices they didn't have before and will be able to comparison shop, in many cases with financial assistance, through state health insurance exchanges. And people will no longer be charged higher premiums due to their personal health history. New requirements will be placed on health insurers to help further a central goal of the law, to expand greatly the number of people with health insurance. By 2014, health reform will require health plans to sell coverage to everyone, no matter whether they are sick or healthy. Today, consumers purchasing their own coverage must go through a medical review when applying and may be turned down based on their health history. The law sets a floor for health plans to provide certain essential benefits, including requiring coverage for preventive health services. In addition, the law limits how much more insurance companies can charge the old versus the young. You can access more information about the Foundation's work in support of the implementation of health reform at chcf.org/health reform. I'm Marian Mulkey from the California Healthcare Foundation. Thanks for watching.